Hello, and welcome to my channel, StudyDocMD. I'm Dr. Ahmed, a resident physician here in California, and I'd like to talk to you guys about a passion of mine, which is studying smarter and becoming effective test takers. I recently passed medical licensing exams in the US called usmle Step 1, 2, and 3 using unique study strategies. And I'd like to share these valuable strategies that I learned after years and years of studying, going through all that schooling and exams, so that you can become effective learners and expert test takers. An average student is often not taught how to study for every subject. All they are taught is if they read a book or class notes and memorized some information, then they can hope to pass an exam by regurgitating the information. I had a similar mindset initially. However, going to medical school and later taking usmle exams completely changed how I used to study and acquire knowledge. This is why I created this course, How to Study, Learn, and Memorize, so I can share these strategies that may help you or somebody you know, particularly in pre-medical or medical field, but most importantly, provoke others and everyone to develop strategies of their own to help them in their journey of acquiring knowledge, be it in any field of study. In this course, we'll go over strategies, how to effectively and efficiently study, learn, memorize, and apply knowledge. These strategies will help you study in a smart way and save you time. According to Bloom's taxonomy, named after American education psychologist Benjamin Bloom, different people acquire information at different hierarchies. Notice that remembering, memorizing, and recalling data are at the bottom of the hierarchy of learning. And as you move higher in your learning curve, you start to better understand, apply, analyze, evaluate, and create information. You may have noticed that children often use all these phenomena to learn. They're often seen integrating one event with another, helping them memorize or understand a new event, item, or a place, or are often seen creating something unique out of the given information or an object. The key point here is that the world has moved past the rote memorization and regurgitation age. Rather, we are acquiring knowledge to apply in daily life and to create solutions for everyday problems. Now we'll go over strategies on how to effectively and efficiently study and acquire information. So, what does the word study really mean? The word study has manifold meanings, such as to contemplate, read, learn, and apply. Before starting to study or reading on a topic, it is often helpful to question what is the purpose of this topic and how is it applied in real life. This will help correlate with real-life scenarios and will help you remember for a long time. For example, if I'm reading about the topic of cell growth in the human body, I'd first ask myself, why is it important to know and how it affects the human body? Then, get a bird's eye view of a topic by reading the table of contents, preface of a book, and headings of an article to begin with. Once you're done reading, try to map out an entire topic or a concept to see how it is integrated in other related concepts, because that also will be the key to having a good visualization in the mind. In our example of cell growth, we will want to see how it happens physiologically, that is normally. What happens to cell growth if there is a disease? And what is its significance in different subjects and other fields within science and medicine? Are there any medications which increase or decrease cell growth? So these are some questions one can think of to get a full picture about a topic. Strategy is to make a habit of reading a dictionary and learning the meanings of the words you are reading on a routine basis. As you start reading, if you come across an unfamiliar word, look up the meaning in the dictionary and try to figure out the root of that word and how the word evolved from that root. Do not just stick to one meaning. As simple as it sounds, we often do not pay full attention to this. For example, throughout our lives we are told to study. No one ever tells what it really means. We often take it as reading and obtaining information. However, as you saw earlier, it has more meanings than just reading. The more meanings of a word you can find, broader the understanding you will have, and more connections you will be able to develop. And once you know the meanings and definition of a word, you will be able to integrate it in numerous ways. Our next strategy of derivation is tied to our previous strategy of learning the various meanings of a word. The word derive means origin, root, to develop, or arise. Derivation is a common phenomenon in languages where one word is used to develop more words. We want to apply a similar idea when we are studying. Once we read and understand a principle or a concept, we can try to derive more meanings from that to be applied in various problems, situations, experiences, be it your studies or at work. For example, some of the principles of pressure and fluid dynamics we learn in physics class work similarly in the human body. Hence, if you learn one thing from a subject, try to apply that concept in several other subjects. In medicine, it helps to know the Greek and Latin roots of medical terminology. Once we understand the meaning, it becomes much easier to understand the concept. For example, there are enzymes in the liver that process and break down the medications we ingest. Some people have more of these enzymes and some less, depending on their genes or their genetics. This concept is called genetic polymorphism. If we were to break down the word polymorphism, it would be much easier to understand this entire concept. Poly means many, morph means forms. Hence, we can easily understand that these enzymes have many forms and variations depending on the genetics of a person. Once we know this information, we can derive that in future. Patients may get genetic testing to check for these enzymes, and based on the levels of these enzymes, they may be administered certain medications. This is called now personalized or precision medicine. As you can see, an emerging field of medicine is being derived from this concept of genetic polymorphisms of liver enzymes. Our next study strategy is what I call extrapolation, or the art of making patterns in life. The word extrapolate means to infer, generalize, deduce, or draw conclusions. It can also be taken as knowing the habit and behavior of something and generating a conclusion based on that. We have a set of information upon which we create a generalized conclusion. This is something we do every day. In medicine, we make patterns all the time to help us figure out the cause of a symptom. For example, anyone with chest pain radiating to the left arm may be having a heart attack. Anyone who has unintentional weight loss may be having some underlying cancer. These patterns help us categorize information. Generally, they are true for the most. However, there may always be exceptions. But more importantly, we try to figure out the physiologic cause behind these patterns to understand why we see them in the first place. Similarly, force of gravity was there before Isaac Newton. He happened to notice this pattern and tried to understand the scientific reason behind things falling on ground, and ended up theorizing the force of gravity. So this is not limited to studying. We can think of patterns in human behaviors too. For example, if your professor happens to give higher grades to students who write answers in bullet points than to those students who are writing long essays in an exam, then that is a pattern you'd notice. And once you start writing answers in bullet points and getting higher grades, then you confirm the pattern for yourself. And moving forward, you will tailor your responses based on that particular professor. So this way, you are making patterns and getting ahead of everybody else. Now we'll go over strategies on how to effectively and efficiently learn and understand the recently acquired information. Learning is a process of acquiring knowledge, information, or a skill through studying or a practical experience. At the learning stage, you are recommended to organize the information you acquired using a systematic approach. For example, there could be many causes of heart disease. However, if we do not have a systematic approach or a method to organize all those causes of a heart disease, the information in the brain may get cluttered, resulting in poor problem-solving skills. Hence, the process of learning involves organizing the information you acquired. One way to organize information is to group things in their own commonalities and making categories. For example, the causes of heart disease can be categorized into several different categories, such as problem with the structure of the heart and its valves, blockages in arteries supplying the blood to the heart, lung diseases, genetic causes, or infectious causes. All these causes have clues of their own, which differentiate one cause from the other. Hence, categorizing the causes will ultimately help us determine the correct treatment course with much more clarity. So learning should involve organizing the knowledge and then applying the knowledge and concepts in real life, making you a proficient problem solver and later on an expert exam taker. We'll go over strategies on how to memorize the information. There are many ways to memorize information, some of which I will discuss below in no specific order. It is best to see what method works for you, as one method may work for someone but not for the other. First is understanding concepts and principles. Once you understand the principles, it becomes much easier to apply the knowledge and reduces the need to memorize. For example, in biochemistry, there is a concept of post-translational modification process that immature proteins, or what are called proproteins, such as proinsulin, which later becomes insulin, these immature proteins go through a modification process in order to become mature and active. After the proteins have been formed during the process of translation, they undergo modification processes which are called trimming and covalent alterations. Trimming involves the removal of immature proteins from N or C terminals of amino acid chains, and covalent alterations involve the addition of covalent groups such as phosphate, sugars, hydroxyl, methyl, acetyl groups to the proteins. So once we know this concept of post-translational modification, we can apply it to proteins in the human body or proteins produced by a virus. Both types of proteins undergo the same process. So instead of individually trying to memorize each protein and its immature and mature forms, one can just understand this concept and apply it to many types of proteins. Scientists then take it a step further and apply this concept by targeting viral post-translational modification processes with drugs to stop the production of viral proteins, resulting in the control of a viral infection. So if you're asked about this concept in an exam, you can apply it to any protein mentioned in the question without having to memorize individual examples of many proteins. Next is spaced repetition. This method involves reviewing the information you study at set intervals, be it after a couple of hours or a couple of days. Typically, it is recommended to review information at day 1, 3, 7, 10, and 20 to reinforce the material in order to ingrain in the memory. Next is memory palace. This technique entails creating an imaginary location where you place a certain set of information you want to memorize at specific locations. Companies like Sketchy Medical, Picmotic, Hitsarize for biochemistry have really utilized this technique to help students memorize details within the field of medicine, which traditionally relied heavily on rote memorization. Creating visual stories and animations can help students retain information very well. Next is writing notes from your own understanding. Writing has long been known to enhance memory. However, transcribing notes from a lecture may not be very helpful. It is recommended to write notes based on your own understanding. Next is making questions. Creating problem-based questions as you go through the study material can help you not only prepare for exams, but also fill in the knowledge gap that you may not be aware of. Hence, answering the why questions as you go along can solidify your knowledge. Next up is creating flashcards. Reviewing information repeatedly is known to help memorize, and creating flashcards with questions often help students remember as well. It works for some, but it doesn't work for everyone. It depends. Key is you want to create your own flashcards, not just copy or download somebody else's flashcards. Next is building connections and hooks. Creating connections and hooks help to learn processes. Using the order of information as a hook for memory may also help you memorize. Then, integrating knowledge. As mentioned earlier, integrating information across different fields of sciences often helps solidify the understanding of concepts and their principles as well. Making patterns. Certain rules and patterns can be applied generally and reduce the need to memorize individual facts. I will share some examples of patterns seen in the human body. For example, tendons connect muscles to bone, while ligaments connect bone with another bone. Shorter muscles lie deeper, while longer muscles are superficial. While learning the nomenclature of neural motor and sensory pathways will make one realize that the origin of pathway is named first and the end is named last. For example, corticospinal tract or the pathway starts from cerebral cortex in the brain and travels down to the spinal cord, while spinothalamic pathway originates in spinal cord and goes all the way up to the thalamus in the brain. Similarly, in histology of human body, you can notice that all the surfaces that require extra roughness or that go through like the tough environment, for example, your skin, your oral mucosa, or certain junctions in the human body, they have squamous epithelial cells, which are known to be more rough and tough and protective in nature, while the columnar epithelium is more for producing hormones, and they are more found in glands. Additionally, if you notice something happening repeatedly, try to note it down and utilize it as well. For example, in genetics, we often see these pedigrees showing the transmission of disease from parents to their children that are often difficult to comprehend in the beginning. However, once we see the pattern in them, they become easy to understand. And here is a pattern that I recognized. So first is you want to check to see if the pedigree skips generation. If yes, then that's typically autosomal recessive. If not, then consider it autosomal dominant. Next is, are one or both the parents affected? If yes, then autosomal dominant. And if no, then it's autosomal recessive or sporadic parental mutation. Then look for if there is there father to son transmission. If yes, then it's autosomal dominant. If no, then it's X-linked dominant. Then also notice, are only male affected? Then consider it X-linked recessive. So these are some examples of patterns that I've noticed in the field of medicine. I highly encourage you to look for these patterns and create a list of your own. Next is chunking, which involves breaking down large pieces of information in smaller chunks, which is another technique often used to memorize phone numbers or names of medications. So that can be helpful as well. Next is categorizing or grouping using a commonality. And this is something I mentioned earlier as well, that memorizing a lengthy list of things can be daunting. Finding commonalities within and categorizing and grouping the things to remember in the list is very helpful. For example, if there are multiple risk factors for a disease, try to find out a common thing among them that helps connect all those risk factors. For example, there's a condition called Ogilvy syndrome, which is a pseudo or a false obstruction of large intestine. Causes of this syndrome include low electrolytes, surgery, opioid medications, anticholinergic medications. All of these causes have one thing in common though, that is slowing the gut motility due to abnormality in the autonomic nervous system controlling the movement of intestinal muscles. And so once we can group all those causes in one possible scientific explanation, then we'll only need to learn that one reason and we'll be able to think of the entire list of things that may be causing this disease condition. Another concept is applying concepts in real-life situations. This is another way to memorize. Applying information in real-life situations can help retain information for long-term, and I've experienced that personally myself. Earlier, I gave an example of applying the concept of viral post-translational modifications and targeting it with medications that can stop these post-translational modification processes, resulting in reduction of viral load and ultimately controlling the viral infection. Next strategy to memorize is creating mnemonics. Mnemonic is a word, a phrase, an abbreviation, a poem, or a visual imagery that may help relate the information you're trying to memorize. For example, you can memorize the names of muscles innervated by radial nerve using our best mnemonic. R for radial nerve, B for brachioradialis muscle, E for extensor muscles, and S for supinators, and T for triceps. Next strategy is using clues. If you have a group of similar things or diseases to memorize, try to look for clues that differentiate one from the other. Develop mnemonics or memory hooks to remember those clues. Next strategy is to create frameworks and mind maps. Building a framework or a skeleton or a flowchart for a topic or a process may help give a learner an overview. It is recommended to first map out a topic and then fill in details. Building frameworks and mind maps helps solidify your knowledge and improve the visualization of the topic. And last but not the least, teaching. Teaching someone what you learn has been found to be a very effective way of learning and memorizing. It also helps to fill in any gaps in knowledge you may have when you're trying to explain a concept in a simple form. So these are some of the many memorization techniques that may help you memorize information so you can retain it for long term. Now, we'll go over strategies on how to effectively and efficiently apply the knowledge. In this module, I'll give you examples of one concept being applied in various fields in science and how to integrate knowledge overall. Application, the art of solving problems. As I mentioned earlier, nowadays we need to acquire information and knowledge to help solve problems, be it on an exam or in real life. Many schools and standardized tests have changed their scope to problem-based learning and testing, respectively. Therefore, students need to adapt accordingly. The idea is to learn one concept and apply it in a variety of situations. For example, the concept of diffusion and osmosis works the same way in human body as it does in other physical and life sciences. The behavior of cations and anions in the human body is similar as in the laboratory environments. Many times, the treatments of certain diseases like seizure and irregular rhythms of the heart are based on the balance of these charges something we study in high school. Chirality is another concept we study in our chemistry classes. The rotation or sidedness of chemical compounds can have huge impact. Various molecules in nature have either a right-sided or left-sided rotation, which completely changes the nature and properties of that molecule. For example, limonene is a molecule found in both oranges and lemons. However, limonene in lemons has a rightward spin, while limonene in oranges has a leftward spin. Similarly, a medication to treat morning sickness in pregnancy called thalidomide created congenital defects in some babies while not in the others. Later, it was found out that out of the two thalidomide compounds, one which spun in the rightward direction treated the disease, while the other spinning in the opposite direction caused congenital defects. In this way, one concept of chirality was applied in different fields of sciences. Therefore, remembering one concept and applying it in various settings will help us understand the concept better and retain the information for the long term. So the key idea here is that when we are in our basic science classes, such as biology, physics, and chemistry, we must try to integrate the knowledge to enhance our understanding and application of basic concepts. I would like to share some of the tips to prepare for exams that I found very helpful. First off, I want to provide tips to help reduce anxiety involved in preparing for an exam, because that's half the battle. So good news is, you do not have to know everything to do well. Know enough about every concept to get a correct answer. It is often recommended to at least know top 3 things really well about a topic and then derive and extrapolate to the correct answer. And select a best choice based on the knowledge you already have. At times, you may need to rule out other choices based on your current knowledge. Now, I want to provide tips to help reduce anxiety while taking the exam. So more good news is, use your current knowledge to derive the answer, as I mentioned earlier. Derive the answer to a question you may have never seen before. Process of elimination for multiple choice questions, as I mentioned earlier, was knowing enough information to rule in or rule out a choice. And then, third tip is, if writing essays, create a short outline and write the answer in an orderly fashion so the examiner knows your concepts are clear. For example, even create like these arrows from A to B to C to D. And the result will be that you will have to write less and it'll save you so much time. In conclusion, learning anything can be enjoyable if one has a systematic approach to acquiring knowledge and understanding the utilization of that knowledge. This course is created in hopes to stimulate learners' minds to create more ways of understanding and learning new knowledge. Thank you.